Hi folks, this is Dr. Mike and welcome to this blog post. Now this is a question I get often. I'm confused. Is it post-rehab or medical exercise training? Now folks, when we started our medical exercise specialist certification back in July of 1994, the concept then was post-rehab, okay? Over the years it's evolved now to medical exercise training. And I know it's a bit confusing because the two phrases are interchangeable, but let me give you a little bit of a clarification. Post-rehab means the direct handoff of the medically based client, whether they're coming out of physical therapy or occupational therapy or medical care. There's a direct handoff from the medical professional directly to the medical exercise professional. That's part of the post-rehab concept. Also, notice what we have here. Less than 365 days. It's less than 365 days from the onset of their condition, the diagnosis, or the surgical procedure. So it's less than 1 year. Now remember, that year after the diagnosis, the onset of the condition, or the surgery, that's a crucial year with regard to returning that client to function. That individual definitely does need the therapy services, physical therapy, occupational therapy, speech if necessary, and other medical care. So in that period of time, that 365 days, that first year is essential. That's essential that we get them the best quality of care. In that 1 year period, after the injury, the onset of the condition, or the surgical procedure, these clients require a clearance or a referral directly from a medical professional. They must have it because, as I said before, that first year is crucial. We want to make sure they're getting the appropriate services, so they must have a medical referral. So post-rehab fitness is that direct handoff or that client that's in that first year or less from the onset of their condition, their surgical procedure, or their diagnosis. Medical exercise training is greater than 365 days. So this is the client that's more than a year out. These clients need to be screened to determine if there's a need for referral clearance. Now, let me explain why we put this component in. When we started out back in 1994, the idea was me, the physical therapist, would pass on my patient to the medical exercise professional. The healthcare system was a lot different then, folks. We had a lot more visits that were paid for by the insurance company. Now, that number has been cut in half. So now we're passing these individuals on faster, or we don't get a chance to pass them on. They're discharged and that's it. The patient now is dead in the water. So what we're finding for some of these individuals is all of this has changed. And here's what we're finding was going on with you, the medical exercise professional out there. You took our MBS course, say back in 1998, 1999. We're now still in contact with you, and in say 2003 or 2004, and now 2019, you're finding that the client is a little bit different. That original idea we had for the handoff has now changed because of insurance reimbursement. Now individuals say your client had a surgical procedure done. They had a total knee replacement done in Rochester, New York. She was still working at a practice there in Rochester, New York. She was maybe a nurse for one of the doctors in the community. Another doctor in the community did the surgery for this individual. Now they've migrated to Tucson, Arizona. You're now a medical exercise specialist in Tucson, Arizona, and 15 years later, this client is coming in, the total knee replacement has been done, she's gone through physical therapy, now she's in Tucson and says, hey, I want to get back in shape, but I've got this total knee replacement, I need to know what to do for it. Total knee replacement isn't my major issue, I just want to get back in shape. Now you start doing some research, you get on the phone and try to call that physician, he or she's not there anymore. Maybe they've passed on, maybe they've moved someplace else, and guess what? You can't get any information now. Guess what, folks? Time is moving on. It's been 25 years since we started this, and the healthcare system is changing. People are migrating. People are doing other things. And guess what? They now want exercise. 25 years ago, this was hard to sell. Now people are saying, hey, I want to exercise to make my medical condition better. So guess what now? You got the medical exercise training client. This client is greater than 365 days from the onset of their condition, their surgical procedure, or their injury. They're now 5, 6 years down the road, even 10, 20 years down the road. This is still a minor issue, but they want to exercise around it. So now they come into your facility. We classify this client as the medical exercise training client. And folks, I bet you this. Probably if I ask you to look back over most of your medically based client, probably a small segment are post-rehab. The majority are now medical exercise based. They're 365 days or greater from the onset of their condition. These clients, you need to screen them to determine if there are any red flags that show up in that screening. We teach the screening in both our post-rehab conditioning specialist and medical exercise specialist certifications. If the screening indicates they're red flags, then you need to find a medical professional in their new community, in the client's new community. You can refer them to make sure they're appropriate for exercise. If there are no red flags in the screening process, you've done everything possible to make sure they're appropriate and they're safe to begin exercise, go right ahead. So the biggest thing between these two is, one, post-rehab, less than a year out from the injury, onset of this condition or the surgery. Medical exercise training is greater than a year. It's simply a one-day difference. Now, our original concept was it evolved from post-rehab fitness to medical exercise training, because we realize now you're seeing more medical exercise clients. That post-rehab client, they're a small percentage of your medical exercise training practice. The medical exercise training client, that number or that individual, those numbers are going to grow exponentially over the next 2 decades. So we just wanted to make sure we clarify that. Literally, these two terms can be used interchangeably, okay? But make sure you understand the key with the 365-day period. If it's less than 365, that means they need to get a referral from their physician, therapist, or chiropractor, because it's less than a year since the injury, okay, or the surgery. If they're greater than 365 days, make sure you screen the client and make sure they're appropriate, there are no red flags. If there are no red flags, you may proceed. Now, let me make sure I'm clear on this. Both of these types of clients, you need to do a medical history on. You still need to assess and screen the client, and what you're looking for in that assessment and screening in the medical history are red flags that indicate the client is not appropriate for exercise. They need to go back to the medical professional. So hopefully that clarifies, which means you're not confused anymore. Anyway, thanks for watching. Best wishes building your medical exercise training practice. And if you want to get more information on something like this or our other blog posts, email me at drmike@postrehab.com or visit our website if you want to become a medical exercise professional at postrehab.com. Or if you want to join our medical exercise training community, you're already a medical exercise professional, go over to medxpro360.com and get more information. Thanks again for watching, and all the best to you in building your medical exercise training practice.